Hey everyone, Dudum here with Dudum Chiropractic. Today we're going to talk about a very common problem we see in the office called IT band syndrome. First thing we have to do is look at what is the IT band. The IT band, or iliotibial band, is a very thick fibrous muscle that runs from the side of the hip all the way down to the side of the knee. Very thick fibrous muscle. What can happen is, as your hips and pelvis get shifted or rotated, the IT band can get stretched or pulled. Usually you get a lot of knots in there, becomes very fibrous or tender. This happens due to a lot of activity. So we see it in a lot of runners, tennis players, athletes, or anyone that's on their feet a lot. And that band gets really stretched and tight and becomes knotted up. So a lot of things you'll see at the gym is you'll see people foam rolling or you see a stretching of the IT band. Typically gives some temporary relief. The other symptom you can get is some hip pain or some knee pain because of the pulling of that band. So if we look at the cause of why that IT band is stretched or pulled, we want to look at the hips and the pelvis. So when the hips and pelvis get shifted, that gets pulled. So in order to address it, we want to look at and we want to realign and create balance in the hips and the pelvis. When that happens, the IT band will go from stretched to its normal state. Now we have to understand the IT band's been tight for weeks or months or even years. So we have to do some muscle work or massage to break up those fibers to allow the pelvis to be offset and balanced. So our goal, figure out how are you rotated, how are you twisted in the hips and pelvis, figure out the IT band, why it's stretched, do some work on the IT band, give you some tips on stretching and foam rolling, and usually this goes away in about 4 to 6 visits in the office. So, again, I'm Dudum with Dudum Chiropractic. I want to thank you for watching this video on IT band syndrome. If you've been rolling out your IT band for weeks and weeks and haven't gotten any relief or have any questions about IT band syndrome, please give us a call at the office or I'd be happy to reply to your answer here on the video. Thank you for watching.